In this video, we will demonstrate the direct technique for the fabrication of a custom-made provisional crown. This tutorial will encompass the fabrication of an external surface form and thereafter the fabrication of a provisional restoration on the prepared tooth. There will also be a brief section on adjusting the occlusion of the crown as well as finishing and polishing. For the purpose of this video, the external surface form index will be fabricated using putty consistency of addition silicon impression material. Nitrile or vinyl gloves may be utilized to ensure proper setting of the material. Precaution not to use latex gloves is to be followed strictly. Equal quantities of the catalyst and base are kneaded together by hand till a uniform mix is obtained. For obtaining a void-free detailed recording of the occlusal pits and fissures, adapt a bit of the putty into these anatomical areas, pressing gently down with finger pressure, and then adapt the rest of the putty material over the occlusal and axial surfaces. Ensure that the cervical aspect of the teeth are covered and the putty extends onto the free gingival area. Do not thin out the index by over-compressing the putty material while it is still soft. The index is to include only one tooth each on either side of the prepared tooth. For this purpose, any additional teeth that have been included should be cut away from the index. Make sure to cut along the interdental area at the far proximal ends of the adjacent teeth so that the entire proximal teeth impression is intact. A thin coat of Vaseline is applied on the prepared tooth and along the proximal aspects of the adjacent teeth. It should be emphasized that no extra Vaseline is left on the tooth in the form of lumps, as this will result in the formation of voids on the inner aspect of the crown. For this video, we are using bis-acryl resin material for the fabrication of the provisional restoration. The mold space of the prepared tooth is filled by gently injecting the material into it. Follow a mild painting action along the recorded occlusal anatomy and axial walls of the index to avoid the formation of voids on the external surface of the crown. Place the index containing the resin over the prepared tooth and press down gently over the adjacent teeth. This is done to ensure a proper seating of the index at the occlusal level of the adjacent teeth and will reduce the amount of occlusal adjustments required later on. Do not press down firmly over the prepared tooth, as it will result in thinning of the occlusal aspect of the crown. The index is now gently rotated off the teeth onto either the buccal or lingual side. This helps enlarge the mold space while removing the index, thereby preventing flattening of the axial contours of the restoration. The excess is removed using a curved explorer or plastic instrument. Take care to remove any excess in the proximal embrasures to avoid the crown from getting locked in. After the material has set, the crown is removed from the tooth and examined for overextensions and excesses in material. Identifying the finish line extension is important so as to remove any overextensions that may injure the oral mucosa. The outer limit of the finish line is marked with a pencil, and anything external to it should be removed. While trimming off excess, some precautions must be followed. Do not hold the provisional in a manner that you cannot visualize the finish line. This may result in inaccurate trimming of the finish line thickness. Do not hold the burr perpendicular to the long axis of the provisional. This would result in a discrepancy at the finish line area. Do not trim off the axial contours of the provisional while adjusting the thickness of the finish line. Holding the burr at a mild angle enables visibility of the finish line while avoiding reduction of the axial contours of the provisional. Occlusal interferences are checked by using a combination of shim stock foil and articulating paper. Shim stock foil is always used between the adjacent occluding teeth. First, the teeth are occluded without the provisional restoration, and the teeth immediately mesial and distal to the prepared tooth are checked for occlusion. The teeth are occluded in maximum intercuspation. No slipping through of the foil indicates good functional occlusal contacts. Thereafter, the provisional is put in place on the prepared tooth, and the procedure is repeated with the shim stock between the occluding surfaces of the adjacent teeth. If it isn't held and slips between the teeth, the crown is higher than the occlusal plane and will require removal of interferences. The identification of occlusal interferences can be done using an articulating paper, which will be bitten upon in the existing maximum intercuspal position. The procedure is repeated until all interferences are removed and the patient can occlude in maximum intercuspation with the provisional restoration in place. The restoration is also checked for marginal integrity and proper proximal contacts. In the end, the prosthesis is finished and polished. In this video demonstration, we are using pumice and a polishing buff as our polishing agents. Moistened pumice is applied directly on the surface of the restoration and is buffed in a mild circular manner.